And Valley doctors say they hope stay-at-home measures will cut down on how many cases we'll see, especially with more cases of apparent community transmission showing up. Channel 5's Taylor Winkle joins us now with that outlook.
Hidalgo County says their healthcare system will not be able to handle COVID-19 unless we do something to mitigate the spread and stop it now before it gets worse. Today, a medical director with Edinburgh Regional told me these next 2 weeks are critical to keep the valley from experiencing trends we've already seen in bigger cities like Houston and New York. On a hot spring day, a playground, almost resembling a crime scene. Caution tape warning neighbors to stay away. Touching these swings isn't worth the risk. Stay at home and play where it's safe.
To be honest, right now we're preparing for a worst case scenario, but we hope we don't get there.
Dr. Paula Martinez with Edinburgh Regional Medical Center says even with a growing number of COVID-19 cases in the valley, we're still not officially seeing community spread yet. She expects that to change soon.
Of course, we already have cases, and we're going to see more cases, positive cases in the next few days. But after that, it should go down. So this is the moment, and we should really take this seriously.
She says if we do everything right to mitigate the spread starting now, that means keeping 6 feet away even when you're in line for groceries and staying at home unless absolutely necessary to go out. We will see cases start to drop off in 2 or 3 weeks. But for that to happen, she says we need to follow direction from city and county leaders and keep our distance.
So right now, at this point, it's still critical. And at this point, it is very important for us to engage in these measures.
14 days isn't just a random number. It's what healthcare systems in the U.S. have learned from watching other countries fighting the coronavirus. Dr. Martinez says she wishes these orders came sooner.
I think that we've been attacking this problem a little bit slow. That's my opinion. I think that we could have done this shelter in place maybe a week before we started, having cases.
And she hopes the valley heeds the warning. With the transition from travel-related cases to community spread, the criteria a patient needs to meet in order to get a prescription for a coronavirus test has been expanded by the CDC. You no longer need to have come into contact with somebody who traveled or somebody who tested positive. That means it's easier to get tested for the coronavirus now, but I'm told testing labs in Texas are seeing a backlog. Reporting in Edinburgh, Taylor Winkle, Channel 5 News at 10.
The hopes are that backlog will go down by next week. According to a doctor we spoke with, new COVID-19 tests with faster results should become available at doctors' offices soon.